Okay, hello and welcome to the video. My name is Wade Smith, and I am or was a first Q in Ishinru Karate and Japanese Jiu Jitsu, and have about 6 to 6.5 years of full time training, 5 nights a week, 3 hours a night in those styles of martial arts. And I further have about a year and a half of Gracie Jiu Jitsu training on top of that, and a month of Shotokan and a month of boxing on top of that as well. So this video is about the easiest possible nerve strikes that actually work in the real world for street fights or for MMA, and which are for whatever reason not seen very often in MMA because a lot of people don't think to do this. Um, Now, against a highly trained opponent, some of them are a little bit harder to use than they would be in a street self defense against a presumably less skilled opponent. That's true. So that might be why some of them aren't seen in MMA, or it could be that one of them might be banned. I'm not sure, but it could be that the fighters are good enough not to give these up too easily. Now, the very first one is taught at white belt in Ishinru Karate and also white belt in American Kenpo Karate. And it's the first block, double chop block of the five swords counterattack combination that comes from Kenpo Karate, which is just basically a basic conceptual counterattack combo that you teach to white belts and yellow belts to give them something to know that will hopefully work in a real street fight. All right. So in this scenario, since about 90% of the time, real street fights start with either a right hook punch or a right clumsy overhand punch. All right, is how most schoolyard fights and street fights start, based on police records. All right. So the Kenpo Karate counterattack to that is, in fact, let's say we're standing and this person is jawing at me and threatening me, and I'm going to be like, "Hey, I don't want to fight," so other people know that I don't want to fight. That might look weak, but it lets bystanders know that I am not the aggressor. So you're like, "Hey, I don't want to fight," and that guy goes ahead and throws a right hook at you anyway. What you're going to do is you're going to step into the punch and double chop block that incoming hook punch. And let's say my arm is his arm coming at you. You're going to hit right here, the lower end of the radius bone, right above the wrist, with your left hand in this case. And your right hand is going to chop block dead center of the biceps muscle right here. There are nerve bundles right there, and muscle damage will be done. And this move will either break the bones in their arm or will deaden their arm for a good 5 to 10 seconds and leave them pretty much defenseless. And you'll be able to finish them off in short order if you're a skilled fighter. All right. Believe me, I've had this done to me when I was a first degree brown belt, which is third Q in the style that I studied. And I was sparring a second degree black belt heavyweight who I was not yet good enough to beat in sparring. And he was 235 pounds and I was only 185, just to give you an example. So he was 50 pounds bigger than me and healthy at 50 pounds bigger than me. And he was a Marine Corps veteran. And so he was a second degree black belt in the same style that I was studying. And he actually hit the nerve bundle right here in the biceps muscle, and it deadened my arm like that. And I had to wave him off and keep him off of me, and told him I'd give up because my arm went so dead I couldn't even raise it. All right. And that's just an example of how well that technique actually works. And he actually managed to hit me in a hard spar with the five swords double chop block, and it deadened my arm like that. So I know firsthand that it does work. Um, he could also hit nerve points in your leg. If you threw a kick at him and didn't get your leg back in time, you would get hit by a nerve point in the inside of your thigh or the inside of your calf. All right. And I don't even know all of those because I didn't study them enough to know. But he uh studied, he constantly had, in his case, his Matt was his first name and Grieger was his last name, I believe. In his case, he had studied medical journals as well as Bruce Lee's books to learn about nerve points and things like that, in addition to what our sensei, our combined sensei, was teaching us. So he went further than what sensei taught in that regards and knew how to hit them. All right, so another nerve point is directly under your nose. And to show how effective this is, try it on yourself. Just push up and back at a 45-degree angle directly under your nose, and it hurts like crazy. All right, your brain won't even let you do it very hard because it will hurt you. So theoretically, this might be a little bit hard to aim that precisely in a real fight, but theoretically, you could knife hand strike that nerve point under the nose, and not only is it going to knock their teeth out, but it's going to knock them out. Okay, uh, a knife hand strike directly under the nose, not on top of the nose. Like if you've ever seen the Stephen King movie where I think it was Firestarter, where the guy supposedly chopped the guy in the nose and killed him in one hit. That does not work. At least we're pretty sure it doesn't work, unless you were just like world record strength at it. You would have to be to kill somebody like that. But this technique is going to knock them cold and knock their teeth down their throat when you hit them right there under that nerve point. I've actually tapped people out with slow pressure before with this. I've tapped out a third-degree black belt heavyweight or super heavyweight in Gracie Jiu Jitsu because I couldn't beat him with the Gracie Jiu Jitsu, so I had to rely on small joint manipulation and pressure points to beat him because he was bigger than me. I'm overweight at my size right now, but he was a 265 plus pounder and a third-degree black belt. All right, so another one is stomach nerve 9 on the side of the neck. You can strike it and karate chop it, especially on the left side. Actually, is more vulnerable than the right side for some reason. But anyway, you can hit and aim for the carotid artery, and you'll hit the nerve bundle anyway. All right, with a karate chop, and that will knock someone unconscious. All right. And then another one is right under the Adam's apple, right above that bone, that joint that's there for all the bones that combine under your neck. There's an indentation below your Adam's apple right here, and you can take one or two fingers and first push up and back, and then push down. And if you do it right, it will actually buckle the knees of the other person, and it only takes a couple pounds of pressure. This one is banned in MMA for sure because all front chokes are banned, and this is considered a front choke. It only takes a couple pounds of pressure to buckle the other person's knees, and if you actually do it full force, you will permanently damage both their esophagus and their both the throat and the windpipe. In other words, so they won't be able to breathe or swallow, and they'll be eaten out of a feeding tube for a couple months. Is how bad you can damage them with one finger right there, and that's why that's banned. That's why all front chokes are banned in MMA. But that is a one finger front choke, and that's also a nerve point, and it's so effective that your knees will buckle. The other person's knees will buckle, and they'll hit the deck, and you'll be able to finish them off however you want to. Let me think. Another good nerve point. Now, this one is more about internal damage to the body than it is nerves. But supposing a person throws a left hook or a left overhand or pretty much anything, a left straight punch, but not necessarily an uppercut, because in an uppercut position, their arm will actually be in a better position to prevent this. But if they throw a straight punch, whether it's vertical fist or horizontal twist punch, or whether they throw a hook punch or a left overhand of some sort, you sidestep the punch and you catch the punch with your left, and then you punch them under the armpit into the heart and lung here, and that's going to disrupt their breathing very much compared to other body blows because it hits direct, and there are nerves and arteries right here, blood vessels right here under the armpit that you're going to hit and disrupt. All right, and that's a targeted vital point punch. It's a lot like the solar plexus. If you hit it, it works. Or it's a lot like the solar plexus or the liver. If you hit it, it works more than this generalized punches to the body that aren't actually hitting vital points. All right. You should practice punching somebody in the solar plexus when you light spar or hard spar somebody in the dojo or gym. You should practice hitting the liver. All right. You should practice hitting the kidneys and other vital points because vital points work better than just generalized non-aimed punches. The reason why some body blows do very little damage and other body blows end up getting a body blow knockout is the difference of vital points. The second one got to hit a vital point, whereas the first one missed the vital point. So work on aiming at the vital points. The solar plexus is practically impossible for anybody to condition the muscles around the solar plexus because that's actually the end of the muscles that join together in your stomach and abdomen. And so there's not a lot you can do to harden that weak point in your body. So it works on almost everyone. Just like a liver shot, there's not a lot you can do to harden your liver. It's an internal organ and it's not a muscle. But if you hit it, it hurts like hell and it will cause a body blow knockout. All right. Another one you can hit is actually the jaw. But you can do this with very effectively with just one finger. Take your finger and jam it under your own jaw right here at the base of the joint where your jaw, the hinge of your jaw is, and jam it up in there. And your brain won't let you go beyond a certain point because it will cause damage. And that's just one thumb. You can actually rip a person's jaw loose with one thumb like that. And incidentally, there is a lot of nerve bundles right there, and this hurts like hell when you do it full power. And it's the same nerves that cause a knockout. Most knockouts in boxing are caused because you hit the jaw and it triggers these nerves and KOs the person. It's not because of concussion or the brain shaking around inside the head, although that is a factor. But this nerve bundle right here will KO you like that if you hit it full power. All right. So you can punch the jaw, or if you're in grappling range, you can grab them by the base of their jaw with your thumb and dislocate the jaw. And in a street fight, if you were in a street self-defense situation, don't do this unless the fight escalates to life or death. Because if you do this and it's uncalled for, you're going to be considered the aggressor and get sued and go to prison. But theoretically, you can take your other two fingers here and grab the lower orbital bone of the eye and pinch down and rip the eyeball out while you dislocate the jaw. And I don't know the actual name of that joint, but it is banned in MMA, as is the eye gouge. But in karate, it was taught as just a kamae, a variation of kamae. And what is a kamae? A kamae is basically an open hand block or a karate chop in the kata. But the bunkai of the kata teaches other techniques. The kamae is just a holding place for a more advanced technique that's too advanced to be in the kata itself. That's what the kamae means. Just like in the Karate Kid movie and the Cobra Kai movie films, you sometimes see Daniel doing kata where there's actually a double punch of some sort, like this, two vertical fist punches or two horizontal twist punches above one another. That does appear in kata, including in some Ishinryu katas, but that is not meant to be a double punch in the real world. That is meant to be a placeholder for a more advanced technique. In this case, it's actually a grappling technique where you grab the opponent by the chest of their shirt or gi, and the low hand grabs them by their belt knot or belt buckle, or grabs them by the groin, and then you can take them and throw them over your shoulder face first and plant them into the pavement. Okay? So double punches and double karate chops are very often placeholders in kata for more advanced techniques. In this case, the kamae that I was describing. So incidentally, he won in Cobra Kai. Daniel won the fight against Terry Silver, ultimately by using a very fake crane kick. Now, I'm not saying that double front jump kicks don't or cannot work. In fact, there's two of them in the Ishinryu karate katas. They can work, but standing on one leg and doing all this doesn't help you make it work. So that's just complete childish foolishness. It has nothing to do with winning a fight. But I'm just closing close in on Karate Kid. Don't fight like Karate Kid. That's fighting like a robot, and you'll get your tail kicked. Now, the second Karate Kid movie where he fought Chozan it supposedly to the death, and then spared him at the end. Um, that choreography was a lot more realistic, excluding the crane kick attempt, which failed because the crane kick wouldn't work in real life. But it was a much more realistic fight because it involved both grappling and striking, unlike the other fights in the Karate Kid and Cobra Kai movies that have very little grappling in their fights. Mr. Miyagi uses joint locks a couple times in some of the fights, and so that's some grappling. But they actually had grappling and a chokehold in the fight with Chozan, and Daniel did a judo throw, and threw Chozan off of him by stepping back and ducking down and throwing over his shoulder all at once. Now, Chozan didn't have an A+ chokehold on him, but it was good enough. But that's beside the point. It tried to simulate real combat a little bit better than the other movies did. All right. So the solar plexus is really both a nerve strike and a muscle strike, and it's a very good target. It's right below most people, right below the sternum. It can be off by an inch or two depending on how fit your opponent is. If they're incredibly fit, it might be strangely another inch lower, actually, because their muscles tend to tighten up and pull down to the abdomen. But it's generally an inch or two below the end of the sternum on people. Okay. And it's very vulnerable to a really good vertical fist straight punch. Horizontal twist punch is fine if that's how you've been taught to fight for all your life. Don't try to do a vertical fist punch just to please me. But I think theoretically we have shown that vertical fist punches are more superior, especially when thrown to the body, than our horizontal twist punches. Now, hook punches still use the horizontal twist, both to the head and the body. Now, what else would I do? So I covered solar plexus, liver, underarm, nerves, and lungs and heart. Of course, we know about punches and kicks and grabs to the groin. I've mentioned that sort of. And then another thing you can do is you can horizontal twist punch down into the bladder below the belt, because even on most men, you would have a hard time hitting the groin itself with a downward punching motion. You'd have to uppercut to the groin in order to actually hit the groin with a punch in most cases. But you can punch down below the belt into the bladder, or right at the belt knot level into the bladder really hard, and it's basically going to make the opponent urinate uncontrollably on themselves. So stand back once you do it, and they're going to double over in pain, and you'll be able to get in knee strikes to the face and whatnot and finish them off just about the same as if you had hit a man with a good groin kick. All right. There are nerve points that are much harder to hit because I've tested them on myself. But right here at the base of the wrist and the hand, there's a nerve point where, let me see if I can get it on the screen. It's kind of hard to figure out how I got to, it's there, and you can try it on yourself. It works, but it's not going to knock somebody out or end a fight. It could get somebody's grip to break if they're pulling on you and you have one free hand to do something to them. Is try that, and you might break their grip. There's a nerve point deep in your tissue right here between your thumb and your index finger that you can hit, which will also break a grip. Okay. It's going to hurt really bad anyway. And again, those two are not going to end a fight, obviously, but they're intended to break the opponent's grip so that you can get your arm free or get them to stop gripping your clothing or something like that. And 9 times out of 10, a good palm heel or elbow strike or punch to the face is going to work more effectively than trying to hit these nerve points in the hand that, again, are not very effective. They're like, low tier nerve points that are not going to work very well, even if an expert does them. Whereas the other ones that I discussed work even for noobs. You can do them. All right. Well, this video is 19 minutes long. All right. Thank you for watching. If anybody watches this, and I don't get much positive feedback because people just don't like me because for whatever reason, I'm not a people pleaser. I'm also not very artistic on trying to control the outcome of my videos. But if anybody watches this and learns anything new, or they or learned a little bit about anything, thank you, and leave comments and whatnot, and upvote my video. All right, thank you.